Hey guys, my name is Ethel and welcome to Ethel's Diary. Today I will be talking about blood pressure and I don't want to waste any time. I just want to make it as short as possible. So let's dive straight in. What is blood pressure? Blood pressure is the force exerted in the arteries by blood as it circulates. And high blood pressure is when the pressure is very high. Blood pressure is written as two numbers, the systolic and the diastolic. I don't know, have you ever been to the hospital? Have you ever checked your blood pressure? Well, if you've ever checked your blood pressure, you will see that they will always write like 120 80, 140 90, like 170. Those numbers, the one above and the one below. The one above is called the systolic and the one below is called the diastolic. So the normal BP range, when you hear me say BP, I mean blood pressure. So the normal BP range is 120 80. A physician can only diagnose a patient to be hypertensive if he has actually checked the patient's BP on 2 or 3 different days and he's constantly getting 140 90 and above. But just checking somebody's BP for one day and getting 140 90 doesn't mean that that person is hypertensive, because sometimes a patient might want to like rush to the nearest clinic to go check her BP. Maybe she walked to the place, and such a thing can actually increase a person's BP. Do you understand? It can actually alter your BP. So I advise you that anytime you want to go check your BP, you will have to, once you get there, just relax for a while before you tell the physician to check your BP. You can tell the person that, I took a walk to this place, so I think I need to relax for some time before you can check my BP. It's okay to tell the physician that, because hey, he might not know that, you took a walk to the place, or maybe you were stressed while coming. Such a thing can actually alter your BP. So you can actually consider yourself hypertensive, or a physician can actually diagnose you as hypertensive when he has actually checked your BP today, tomorrow, next tomorrow, and still your BP is giving 140 90 and above, consecutively. So, but apart from that, just that your BP increased today doesn't mean that you are hypertensive, because one thing or the other must have altered it. Yes, maybe that what I just said must have altered it. So that's by the way. Let me not say much story on this. Now, what are the risk factors for hypertension? We have modifiable risk factors and non-modifiable risk factors. When you talk about the modifiable risk factors, you talk about the unhealthy diet. Coming to that unhealthy diet, guys, I talked about this thing in my last video. Guys, too much salt intake, too much salt consumption. Kai, how will I say this? Guys, run away from salt. It's not good. So too much salt intake is not good. I just don't want to stress it, because I just want to make this video as short as possible. Then after too much salt intake, a diet high in saturated fat and trans fats. Then lack of taking, or should I say lack of eating vegetables and fruits, and too much alcohol intake, and tobacco smoking. These are the unhealthy diets that you should stop because it's modifiable. Like, these things are things that you should actually stop. Now, non-modifiable risk factors includes a family history of hypertension, age above 65 years, and coexisting disease like diabetes or kidney disease. So, what are the common symptoms of hypertension? You see, hypertension is actually called a silent killer because most people don't even experience any symptoms. Like, you might even be hypertensive without even knowing that you're hypertensive until one day maybe something will take you to the hospital, and a physician gets to check you, then discovers that, oh, madam, your BP is very high, or oga, your BP is very high. Maybe you can come tomorrow for us to check again so that we can confirm. Do you understand? You will not even know. You just be going about doing your normal things, just the waka, they go, they feel like, say, you they can't pay. You won't even know. Like, hypertension is that bad. High BP is that bad. Seriously, guys. So, how do you now know? How do you now know? But some people experience the symptoms and signs such as early morning headaches, nosebleeds in some people, some might be feeling some tingling in the ear, anxiety, chest pain, fatigue, and so on. So now, guys, I will always advise you to, once in a while, anytime you find yourself like in a health center, just tell a physician to please check my BP. I just want to know what my BP is. I just want to check my BP. Can you please kindly check my BP for me? Even when like they feel uneager to check your BP, just tell them to please check your BP for you. But I know that like it is very standard in every hospital. Once you come, they will take your vital signs, and that includes your BP. So it is always good to go for a checkup. Don't sit and wait till you are very sick before you visit the hospital. Always once in a while, maybe once in 3 months, you can visit the hospital. Guys, I am very serious. It's for your own good. Visit the hospital, know your status as they are taking your vital signs. You're knowing all those things. It's very helpful and it's very good for you. So guys, let me list some complications of uncontrolled hypertension. Number 1, heart attack. This occurs when the blood supply to the heart is blocked and the heart dies due to lack of oxygen. Number 2, heart failure. This actually occurs when the heart is now very incompetent to supply blood to every other vital organs in your body. You know what that means. Again, irregular heartbeats can actually lead to instant death. Another one again is chest pain. I mean angina. Sometimes you might have chest pain, and if you go to the hospital, you will see that it's as a result of acid reflux, and sometimes it might be as a result of the fact that you have peptic ulcer. But this one I'm talking about, this chest pain I'm talking about now, is called angina. Is angina. So how many have I mentioned now? I've mentioned heart attack, I've mentioned heart failure, I've mentioned irregular heartbeats, I've mentioned chest pain, and so on, and can even lead to stroke. Now, how can it be controlled? Number one, reduce the amount of salt you take on daily basis. If you're this kind of person who likes taking adding half teaspoon of salt in your food, then you should divide that half teaspoon of salt into 4 and take 1/4. Start from there. Just reduce your too much salt intake drastically on daily basis. Number two, you see saturated fat. Run away from saturated fat. That thing means no good for your health. Instead, replace it with a lot of fruits and vegetables. Again, if you are a tobacco smoker, if you are a kind of person who smokes, just stop smoking. It's not good for your health. It's not good really for your health. And if you are this type of person who drinks a lot, who drinks too much alcohol, stop too much alcohol consumption. Too much of everything is bad. Reduce your alcohol intake and improve your physical exercise. Engage yourself in a physical exercise. It's very good for the blood circulation. It's very, very good for your cardio. Then reduce too much sugar consumption. It is not good for you because you take a lot of sugar, you add weight, and once you add weight, it's predisposes you to hypertension. So what else? If you find out that you're hypertensive, you will have to make sure that they place you on pills. You have to be on pills, antihypertensive drugs. These things will help put your BP in check and make you live longer and even happier. So guys, I think I've actually come to the end of today's topic, and I so much thank you for staying with me till the end. I hope this one is not lengthy. I tried so much to make this video very, very short, and I hope I achieved it, guys. So thank you so much for listening, and God bless you. Please do not forget to subscribe to my channel and also click on that post notification bell so that once I drop another video, you'll be the first to get notified. Okay, so I thank you so much and love you guys. You guys are the best. Like,